right, good morning, everyone. I'm Hartford Healthcare's Tina Verona. Thank you so much for joining us on this Friday before the weekend. We appreciate it. We have a panel of experts today, and we also have a very special guest. We, of course, have with us Dr. Ulysses Wu, our Chief Epidemiologist here at Hartford Healthcare. We also have Kevin Ferratti. He's our Senior System Director of Emergency Medical Services at Hartford Healthcare. And we have a special guest, Will Rubino. He is a kidney transplant recipient who had COVID about 2 weeks ago and just received monoclonal antibodies last week and is on the mend. So I want to actually begin a little bit differently today. I want to begin with Will. If you will, thank you first for joining us. And please share your story with us. It's an incredible journey that you've been on and you continue to be on. But share with us your story from where we are right now.
Sure, absolutely. So actually had a kidney transplant October 5th of 1999 down at Johns Hopkins. Lucky enough to get it from my father, who was very generous at the time. And that had been sort of a lifelong condition that ultimately ended up in having to have a transplant. So had that done successfully back then. And then, as you know, you have to take your regimen of medications for the rest of your life 3 times a day to make sure that everything stays healthy. So you have been pretty diligent with medication. I think about 95% of rejection episodes are because patients sort of feel good and they stop taking their medication. So you got to be very, very diligent in taking your drugs. My uncle is a psychiatrist down in Chapel Hill. And when COVID first came out, he spoke to one of his expert infectious disease docs and said, what's with COVID? And the doctor responded with a 1-word answer. And all he said was hide. So once he relayed that to me, I actually moved to my office. Lucky enough, I sent by the people I work with home, and I was able to live in my office for the first 90 days away from my wife and 2 small kids because my wife is a pharmacist. She was still working. My kids are sort of germ factories, being 2 and 4 years old. And because of so many ambiguities, I basically just stayed at home, stayed at the office for a few months. And then once things sort of unfolded and told their story, I moved back home. But needless to say, in the last few years, I've been haven't really gone out to eat, haven't really traveled anywhere, been pretty strict to make sure that I mitigate risk. And I think that's the most important thing is when you're immunocompromised, you can't take your health for granted. So you really need to do whatever you can to mitigate risk. So that's really been my sort of the last 2 years of living is I got to rip the Band-Aid off eventually, but you got to mitigate the risk. So unfortunately, just like sort of spreading like wildfire a couple of weeks ago, I think either from my daughter or my son probably gave it to me, unbeknownst to me, myself. And last Saturday, I woke up and had a sore throat and sort of just because I had a couple tests, I basically took a test and then got a test and it said I had COVID and did some research and realized that this new treatment was maybe something I didn't need. But if you're immunocompromised or you have underlying conditions, it's really important to be proactive in those situations. And I felt it was, the responsible thing to do for me was to seek that out. So I was able to get an appointment with Hartford Hospital. I went in, I believe, last Tuesday at 9 a.m. They meet you outside, they walk you up. There were 2 nurses who were fantastic. They basically let you know what's going to happen. You sit in a chair, there's a television. And they let the medication warm up, then they inject it. It takes about 30 minutes to get the actual infusion. It's sort of like getting a vitamin drip. If you've ever had one of those, it's very non-invasive. And then they basically monitor you for about an hour and a half afterwards to make sure you don't have any rashes, to make sure that you're able to communicate and that you're cohesive and lucid. And once I sort of passed those tests, then they sent me on my merry way and I went home. And I certainly didn't feel great. I had a fever at the time of the infusion. I didn't feel great, and I got home, and within the next few days, I actually didn't really feel better, but I didn't feel worse. And then after about 48 hours, the fever went away. I haven't had a fever since maybe last Wednesday night, so week and a half. I still have some lingering, a little bit of a cough. I have really big fatigue and sort of that lightheadedness that you get, I suppose. I don't know how long that'll last, but just I'm just trying to rest and hydrate and drink. But I would say that it's, I don't know, would I have ended up in the hospital if I don't have it? I have no idea. But I think that it's so important that you be proactive in those situations, because for me, I do know people that are, I'm vaccinated, I'm boosted, and they have 103-degree fever and they didn't have a kidney transplant. So my only thought is, you know what, maybe if I hadn't gone in, that fever would have escalated on Tuesday. And then, instead of being in that Conklin building at Hartford Hospital, I would have been in the one next door, which is the one you want to stay out of. And so I've always just been more of a common sense person. For me, as soon as that vaccine was made readily accessible, my wife's a pharmacist, so I forced her to get some for me and jab me, and same thing with the booster. And I don't want to, sound judgmental, but for me, it wasn't a vaccine or it was a booster. It was just an IQ test. And I think that's all that booster and vaccine is for me, is it's an IQ test, because the benefits outweigh the risk. And why the heck wouldn't I get that? Not getting it never crossed my mind, especially as everything I've been through. And now I'm, sort of, hopefully, knock on wood, on the road to recovery. But that's sort of where I stand, and I hope people would make the same decisions that I did, just from a common sense standpoint, because you just can't take your health for granted. And so hopefully the next few days I get better. But it was certainly, who knows, maybe it did keep me out of that other inpatient building that I don't want to be in. So I'm very, very thankful for everyone, and the staff, and everyone was wonderful.
And so, Will, thank you for sharing your story, a very detailed story and account of what you've been through the past 20 years with your kidney transplant, and then making the decision to have the monoclonal antibodies. It actually sounded like it really was a decision that was pretty much made for you, and you really didn't think twice about it. Is that the case? And what do you say for others who might be on the fence out there?
I think it's very, when the vaccine came out, and I called my nephrologist and I just said, hey, listen, the vaccine, kidney transplant people, what's the deal? He goes, oh yeah, the benefit outweighs the risk. And so as soon as I heard that, I went and got it. And I wouldn't be where I am, even probably alive, without doctors, right? I mean, performing a kidney transplant isn't very, very easy task. You have to be pretty specialized to do that. So I'm a big believer, especially with having physicians in my family, that those definitely are the heroes. So I know it was, if anything, I would have done anything to get it, right? Even if I didn't have a fever, but I had COVID, to be proactive in those situations, what's to say it could have gotten worse? So I think it's a no-brainer for anyone that's on the fence. I think if you've had a kidney transplant, they don't take their health for granted. So I doubt there's a lot of people on the fence. I think if you're immunocompromised or have maybe some, whether it's other transplants, whether it's something oncology related, whether it's underlying, conditions that you have, it's literally, a drip. The only side effect potentially is getting a rash. Like if you, get a rash from an IV, that's literally the only side effect. I didn't get that. And so in my mind, the peace of mind that you get having that drip, knowing that that's just another safety net that you now have, another layer of insurance that you have from keeping you out of that being hospitalized situation, is certainly a no-brainer. And I certainly would urge anyone in my situation or similar situations to run out, probably sprint out and get it.
Peace of mind is certainly everything. You can't definitely put a price tag on that. We thank you, Will, for sharing your story. We do have some questions coming into the chat, but before we get to them, Will, I do see a question for you as well. Before we get to them, some big news that we want to share across Hartford Healthcare today. First responders, they're always there for us. Hartford Healthcare is there for them. Starting today, we are providing no appointment priority COVID-19 tests for all first responders at all of our 8 locations throughout the state of Connecticut here. And that includes law enforcement officers, paramedics, emergency medical technicians, and firefighters. So I want to bring in now Kevin Ferratti. He's our Senior System Director of Emergency Medical Services here at Hartford Healthcare. Kevin, a big day for first responders and for Hartford Healthcare.
Absolutely. Thank you, Tina, for having me. And 100%, right? We want to make sure that Will and anyone in the public that needs a test is getting a test, and making sure that, we're getting those results back as quick as possible. But for those that are on the front lines, our first responders, our dispatchers, our EMTs, paramedics, as you alluded, we need to make sure that we are making sure that as much as possible is that we're getting the testing to them And then, by prioritizing them and allowing it to be so easy for them just to come in between 8 a.m. and 9 a.m. every single day at any of our public locations across Connecticut, we're going to prioritize them. We're going to get the results back. So not only are they going to know and have a better peace of mind, because again, being on the front lines, being in what we call the trenches of the ongoing pandemic, it's a peace of mind for them to come back to as well and know that they're not either negative, and they're able to keep themselves safe, their partners safe, their crews safe, and then most importantly also their families safe. But then also if they're positive, we can take the steps at each department, each agency across our state in order to isolate them and ensure that they're getting the proper treatments necessary, so they can then properly isolate, properly heal, and then get back on the road and go back to helping.
Certainly an important population to be tested. Kevin, do you have any early numbers at what we're seeing across our sites? I know today is day one and it just started in a matter of hours, but what are we seeing so far?
Yeah, thank you. So over the last, from 8 a.m. to 9 a.m., we saw, roughly about 3 to 4 individuals at each site, which is fantastic to think. That's 30 to 40 more first responders that, we theoretically helped today, that, for as difficult it is to get a test now, that we're able to now take those 30 people that may have had to wait several days, and now they're going to be getting the results back by Monday the latest, if not even tomorrow.
Wonderful. Well, Kevin, thank you for sharing that. I know we do have some questions we will get to, but I want to turn it now over to Dr. Wu for a system update across Hartford Healthcare. Dr. Wu.
Hi there. Good morning. First of all, I'd like to thank Kevin really and all of his help for being there on the front line. I mean, we couldn't do this without you guys, and we really appreciate this. It certainly takes an army, and we appreciate it. I'd like to also thank Will. I mean, you said it was common sense. You said it was an IQ test. You really, for everything that you do, it helps people like Kevin and myself out as well. And I really appreciate you getting the vaccine and getting the monoclonal. I'm glad that we were able to set up a process for you to be able to get that. And most importantly, I'm glad that you're better. But I want to thank both of you. Really appreciate it. With regards to our numbers are good, right? Well, I mean, it's relative. The numbers are still bad, but they're better than yesterday and they're better than the day before. So what do I mean by that? We've used the roller coaster analogy, and we are well into our downslope of our roller coaster. So across the system, we have 489 patients. Hartford Hospital, we have 221. And remember, these are COVID patients or incidentally COVID positives that are here for other reasons. So Hartford Hospital, 221, HOCC, we have 70. Bradley, we have 5. Midstate, we have 40. Bacchus, we have 45. Wyndham, we have 16. Charlotte, we have 26. And St. Vincent's, we have 66. Those requiring ICU level of care, we are down to 63 from our high of 71. And so that's the numbers for HHC. And for the state numbers also seem to be dropping very nicely. Unfortunately, as we know, that deaths do tend to lag cases and hospitalizations by about 7 to 10 days. The unfortunate thing is that the death rate is still fairly high, but we expect that to be coming down as well. And we've passed our peak for that. It's been actually about a week since we've had our peak death rate. And so unfortunately, we're still seeing deaths, but that is the unfortunate side effect of seeing such high amounts of cases. So that's where we're at right now from an epidemiology standpoint.
Dr. Wu, thank you. And speaking of side effects, Will, when he was speaking, was talking about some of the side effects that he had after the monoclonal antibodies testing, and had mentioned, are these normal or not? Are they typical in terms of what you would experience after testing?
So anytime you get the monoclonal infusion, anytime you get any infusion, you can have a reaction. They've actually, if you go back to the old days, people used to get placebo infusions and they would actually still have reactions. And so we are very cognizant of the fact that anytime we put a new medication inside you, we have to be aware of that. But for the most part, it's actually been incredibly safe. There are cases where people may feel lightheaded, they may feel really weak, they may have a rash, they may develop hives, but that actually reaction has been far and few between for most of the medications that we are actually dispensing at this point.
All right, thank you. We're going to open it up now to reporter questions in the chat. We have quite a few coming in. The first one from Tracy O'Shaughnessy at the Waterbury Republican American. Could you comment on Scott Gottlieb, a former Food and Drug FDA administration commissioner's statement yesterday? Now, the quote, now there seems to be more of a consensus building that this Omicron wave may well be the last major wave of infection. Any thoughts on that, Dr. Wu?
Yeah, so I like Scott's comments because he was one of the few people to predict that actually we would have a surge over the winter as well. So we were in agreement with him. So it's really all relative. It depends what your definition of a wave is, right? And so I think very early on in our media briefings, way before this, we talked about the Pacific wave, and then we talked about the Jersey Shore wave. And I'm from Jersey, so I can say our Jersey Shore waves are much smaller than the Hawaii and Pacific waves. And so I would still expect us to say that we're going to have a wave. Now, it's going to be very dependent on a few things. It's going to be dependent on our immunity, and it's going to be dependent on the possible presence of new variants. If new variants arrive that may be either more infectious or more lethal, we could still face waves. But the reason I prefaced all this by it depends what your perspective is because let's take a disease like influenza. We have an influenza wave every single year. It just doesn't get that much attention. And so I would expect that, let's say best case scenario, no variants happen, COVID sort of dies down over the next, few months. Around this time next year, I would still expect us to see some sort of wave, whether it's a Jersey Shore wave or Pacific wave. That's going to be very dependent on things like variants and as well as immunity. So that brings into question, are there going to be boosters as well that are going to be required? Well, if people are boosted heading into, let's say, the next theoretical wave, whether it's a big one or a small one, that's going to tamp that wave down. So I'm going to disagree and say that there's not going to be another major wave because I think every year it is kind of a major wave anyways.
All right, our next question comes from Jordan Fenster from Hearst, Connecticut Media. We're hearing about a surge on emergency room departments across Connecticut. Can you say how often ERs in the organization have had to redirect ambulances during the Omicron surge? Dr. Wu, do you have anything to shed on that?
Yeah, I can't actually answer that question. So I don't know how often ERs in the organization have had to redirect ambulances. I'm going to say it's probably fairly uncommon because we are actually helping out some of our sister hospitals not within the system and taking patients as well. So because we have never really gone to exceeding capacity, and we are obviously still doing elective procedures. I know that the ERs have been very busy, but I can't actually comment that we've had to turn people away. I would suspect that it was fairly uncommon.
All right. Question from Tracy to Will. And Will, you did mention that you were vaccinated and boosted. So Tracy's question is, how did you feel both physically and mentally after contracting COVID, after your diligence in trying to protect yourself? And did you only have one infusion? Did you take any other therapeutics like the antiviral?
Yeah, so I was obviously vaccinated with Pfizer twice, and then I received my booster the first week of September. So that certainly gave me peace of mind, especially when I didn't have any antibodies after the first two, which is very common with transplant patients. And then I actually developed some after the booster. So I was super jumping up and down about that because there was, of course, a chance I didn't develop anything after the third shot either. So I know that gave me definitely a level of protection. Once I did contract the virus, I spoke with the physicians. They told me about this one infusion to get, other than maybe one Tylenol every other day. Other than the infusion, that's all I had. So I didn't have any other type of treatment, and haven't had any since.
All right, thanks, Wu. And then second part of her question for you, Dr. Wu, would a patient take both antivirals and monoclonal antibodies?
So the antiviral is a medicine that's really approved only really for inpatient use, though we are starting to see a 3-day course of, I think we're referring to remdesivir as the antiviral that can sometimes be given in the outpatient setting. But there's a lot of logistics associated with that. Obviously, it's over several days. It's an infusion. There is the cost associated with it. And so we are not currently giving both together. Now, I would say that the monoclonals, the one that Will received, it's actually basically keeping people out of the hospital. So we haven't had patients really come in who have gotten monoclonals where we'd have to give them an antiviral once they came into the hospital. But to answer the question in a short way, we're not giving both as an outpatient.
Question for Mike Savino, WFSB Channel 3. Has Hartford Healthcare seen patients receiving either of the oral COVID pills? What are we seeing about how those pills are performing in the real world?
So I'm gonna say that they're performing actually pretty good. So we're giving more of the Paxlovid, and the other one is called Molnupiravir, which is actually named after Thor's hammer, I believe. We are giving mostly Paxlovid at this point because the studies have shown that it may actually be more efficacious. Now, we have prescribed some of the Molnupiravir, but we're really reserving that for those who either don't qualify for Paxlovid because of drug interactions, or they are unable to get it, or they cannot get the infusion, such as the monoclonal antibodies. So it's really reserved as third line. And we also cannot give it to pregnant patients as well. How are they performing? Again, same thing with the monoclonal infusions. We haven't been seeing a lot of patients coming in who have received that either.
Question from Jordan, First Connecticut Media. Much of the state has slowed down contact tracing efforts in the midst of the Omicron wave. Do you think we will pick up COVID contact tracing in the future? Will it be relevant again?
That's a good question. Contact tracing it's very intensive. Not only is it time intensive, it requires a lot of personnel to do. So I didn't want to say that the state slowed down contact tracing in the midst of the Omicron wave. It was more that they were just really unable to necessarily have the personnel to do it. So I think contact tracing was still going on, but it was being targeted. And a good example, or the analogy, is our institution. We didn't do contact tracing for every exposure. We really looked at things that we needed to target, whether or not there was an outbreak, a lot of patients or a lot of staff may have gotten sick. We would certainly contact trace in those situations, but we weren't contact tracing every single positive.
All right, thank you for that. I don't see any other questions in the chat. So at this time, we will have closing remarks. And Dr. Wu, let's begin with you.
Yeah, I think I'm going to end with the same closing remarks I did either yesterday or the day before. I can't remember which one it was, but it's all relative. And I think that's the key here. Even though things are getting better and things are on the downswing and we are likely past our peak, it doesn't mean that we have to take the pedal off the metal or our foot off the pedal at this point. The only way we're going to beat this going forward is to continue to do the smart things. And I like the term, the IQ test, and because I think that's very important. Will, I'm going to steal that from you from now on. I'm definitely going to use that, but it really helps not just myself and people like Kevin, who are our admirable first line responders, but it also helps your community. And with COVID, it being a societal disease, there has to be a sense of community, a sense of community responsibility. And so I highlight Will as somebody who has helped us as a hero, because what he did helped offload somebody who would be taking care of somebody else in the hospital at this point for something else. And I think that's very important. And, by having a sense of community about this, we will hopefully decrease the spread. But I don't want people to think that this is over, because like I said, even though rates are decreasing now, and let's say no variants come, and let's say we do great over the summer, we do have to worry about this again next year. Once it becomes endemic. And so I want everybody to be cognizant of that this is definitely a community effort. I'm happy the numbers are going down. We're all very tired. We're all weary, but we're certainly not letting up the fight.
Dr. Wu, thank you. Kevin, I want to turn it over to you. Final thoughts on first responders and getting priority COVID testing across Hartford Healthcare.
Yeah, thank you. And I do, echo the same comments that Dr. Wu has, and I highlight the word responsibility because as first responders, we have the responsibility to our communities to keep ourselves safe. And then it's our responsibility from a healthcare perspective to make sure that we are equipping our first responders with every tool necessary to combat not only this virus, but everything that comes our way. So, I cannot be any prouder of our system with the prioritization that we have done with getting and making sure that our first responders have the vaccine first, and now adding the ability for them to make sure that they're getting tested as soon as possible thereafter. That's just one extra step in the way. And hopefully we can, continue to highlight the great work that first responders do throughout our communities, throughout our state, and obviously throughout our nation.
Such an important effort to keep our first responders out there on those front lines. They're so desperately needed. Kevin, thank you for all that great work. And Will, any final thoughts?
My grandfather was a judge way a long time ago, and he had only one sign above his desk at home, and it said "think." And I think it's really important in these times that, that common sense has to prevail, and that you have to think about others, not just yourself. So I think that words of community and responsibility, you look at, the doctor and the first responders and the responsibility that they have to the community. I think the community has a responsibility to the doctors and to those people that are putting their lives on the line to, do those common sense type activities. Especially with those underlying conditions, I would do anything that I can to make myself better. And at the same time, if I free up a bed for somebody that absolutely needs it, it's good. But I think in these times, you have to think about people other than yourself and your family and others in community, and what can we strive to actually get this behind us. When this pandemic started, as soon as my mind was, well, as soon as we get a vaccine, we'll be good. It did never cross my mind that somebody actually wouldn't take that vaccine. But, I think if you can just think a little bit about what the right thing to do is, hopefully this will get past us relatively quickly. I know it's been pretty arduous for everyone. So I thank, obviously, the physicians and the responsibility that Kevin and his team does. It's certainly selfless acts, and just certainly hope everyone stays safe.
Well, Will, I think you're a shining example of not only taking care of yourself, but really for everybody else around you, for your loved ones, family, and those in the community by taking the steps that you have taken to protect yourself and others around you. So we really thank you. We have much gratitude to you for sharing your story. I'm sure it will inspire others and help others in similar situations. So thank you for joining us. Kevin, thank you. Dr. Wu, as always, thank you. And to all of the media and those on Facebook watching us, thanks for joining us. We'll see you next time. Have a great weekend.